So Fayette's definitely a different clinic compared to some of the others. We do a lot of acute care. There's not any emergency rooms or urgent cares or quick access cares in town, and so many members of the community want to come here when they're sick, and so we end up doing quite a bit of urgent acute care. In addition, we get to do quite a bit of musculoskeletal care. There's not a lot of the competing specialties out here. We have a cardiologist that comes out once a month or twice a month, but otherwise there's our office and then one other family medicine clinic in town. So we really get to do a little bit of everything. We get to be the pulmonologist, we get to be the GI guy, we get to be the psychiatrist, all in a town where folks really don't want to go to Columbia unless they absolutely have to. So we get to do a lot of procedures. We get to be a dermatologist. We get to be kind of an ER doctor at times with laceration repair. And then we do some splinting and casting as well. So I think we have a really well-rounded approach to family medicine in a small town where we get to do a lot of procedures, and our patients really want to stay here as much as possible.
Fayette offers a lot of variety. So being in the rural setting, it's a lot like the job I hope to have someday, with lots of kids, lots of adults, lots of prenatal care, really a wide variety of things, and seeing stuff that would sometimes otherwise go to the emergency department. We get a lot of acute care out here, so you really get a wide scope of family medicine out here.
Fayette, the community itself, and your relation to the communities around. So not everyone that is in the clinic comes from Fayette, but surrounding communities, New Franklin, Boonville especially, very unique communities, river town communities. So you get to see all walks of life, blue collar, white collar, people who don't necessarily want to drive all the way to Columbia, and you can provide excellent care here.
Fayette to me offered the best of both worlds. So that's the other thing I love about Mizzou. I could get rural training, and to me rural training meant that I got broad scope training. I do skin procedures and casting and splinting and all the things that I wanted to do in a family medicine clinic, but I also am attached to a tertiary care hospital. So during training, you take care of the sickest of the sick patients, so learning is better. So for me, it was the best blend of training that I could get, and that is why I chose to come to Fayette.